Hi, I'm Dr. Andrea Sundholm. I'm one of the surgeons here at DLEAH, and we are prepping this patient here for an abdominal explore. So right now she is on her back, and so we are first going to shave just some general margins of where to clip. And so in general, we palpate their xiphoid process and then go a few fingers cranial to that. Our abdominal explorers typically start at that point, so we want to give ourselves a little bit of extra room on the cranial side. And then a good caudal margin will be the brim of their pelvis. And so if we need to extend our abdominal explorer to include maybe the reproductive tract or the bladder in this female dog, then we have enough room caudally to extend our incision. And you could consider the same for a male dog. You just have to include the hair that's on their prepuce. And then on the sides, we generally go a little bit wider than where their mammary glands on. It tends to get even close to their flank folds. Again, just so we have enough room to drape and then also not be encroaching on any of that hair. So other things that could be performed around the same time, we could palpate their urinary bladder and see if that should be expressed to make our approach and explore just more easy. If the urinary bladder is really big, it's just easier to have that expressed before surgery. For scrub, we will have a combination of either chlorhexidine scrub and solution, or alternatively, you can do betadine and alcohol, but basically you're picking a scrub and then a rinse to pick in surgery prep and then also in the operating room. When we are out in prep, the individual who is doing the prep can wear exam gloves, since we have not started to do a sterile prep just yet, but in the operating room, they will switch out to sterile gloves for the sterile prep. While you are using clippers to prep the abdomen, it's important to check on the temperature of the clipper blades every once in a while, as they can become warm and you would be risking creating some thermal burns on the patient's skin. So if you feel that that blade is getting too warm, you can pause and use some clipper cool on it, or even just change blades. So once you have completed even some amount of clipping, we use a vacuum to get rid of the excess hair. And then you can even pause and restart the vacuum or restart the clipping again. And once the vacuuming is done, then we'll go ahead and use a lint roller to get the really fine hairs off of the patient's skin. And it doesn't have to be a one time and then you're done with those two. You can pause and do a vacuum and a lint roller and then see the areas a little bit more clearly that might need a bit more work. And so you can vacuum again once you're done going over things again. So once we are done with our clipping and we've vacuumed and we've lint rolled, For this patient, we have chosen chlorhexidine scrub and solution. Again, our assistant is wearing just exam gloves because this is considered our rough or dirty prep. So we still, knowing that we're going to do an abdominal explore, we begin the prep at the site of our incision and then circumferentially kind of move our way out towards the hair. And then once we have done that, that gauze then is discarded. The rinse for this pet is chlorhexidine solution. There is not really a specific number of gauzes or times that you need to do it. Out here, it's more based off of what the gauze is looking like after you have done kind of each swipe. So if the pet is particularly dirty, then you might be spending a little bit more time out here prepping the skin. If this was a male dog, we would also be including a prepuce flush in our prep. And so that is typically done after the skin has been clipped and vacuumed and lint rolled, but before we start doing our sterile prep. And that is where we instill probably anywhere between 10 to 15 mils of chlorhexidine solution into the prepuce, and then kind of with pressure, push it out just to get rid of any of the exudate that is naturally occurring inside of a male dog's prepuce. Depending on the type of surgery, that may be within your surgery site, and so we try to prep that too to make sure you don't have any contamination to your skin. Once your gauze is looking relatively clean, we then, in order to increase our contact time and moving a patient into the operating room, we do place our scrub solution on the gauze over our incision site, again, just to increase contact time. This is relatively easy for patients getting an abdominal explore because it can just sit there pretty nicely. Depending on the location of your incision for other sites on the body, this may not stay super well, but again, this is just our attempt to increase our contact time for the skin prep prior to starting our final sterile prep and then abdominal explore in the operating room. When we move patients out of our prep area, we do not take any of the towels that they are laying on with us, as they will contain extra hair from the prep. You want to try to leave all of that out here and not bring any additional hair in with you into surgery. That may also include lint rolling the hair off of your scrubs, or maybe removing some sort of gown that you were wearing if you have a particularly fluffy dog. We just try not to bring any extra hair into the operating room with us. And that is how we prepped this dog for an abdominal explore.